and tattooing, they are not present, please don't write this decision, not present around the margins, but they will be present inside the track of the wound. Okay? Now please listen, when in a question nothing is specified, whether it is asking about the around the margins or inside the track of the wound, it usually means around the margins. It usually means around the margins. If nothing is specified, it means that they are talking about whether the singeing, blackening and tattooing are present around the margins or not. So in contact wound, singeing, blackening and tattooing is not present around the margins because everything will go inside. The flame, anything, it will not, they cannot come outside. Everything will go inside the track of the wound because the gunshot is in contact with the body. But they are not present around the margins in contact wound. In close contact, yes, they are always present around the margins. Basically, when we say singeing, blackening, tattooing, we mean whether they are present around the margins or not. So in close contact, they are always present, singeing, blackening and tattooing. In intermediate range, they may be present, they may not be present. In intermediate range, they may be present, they may not be present. In distant wounds, they are never found. In distant wound, they are never found. Okay? And cherry red discoloration occurs because of carboxyhemoglobin level. Because what occurs is carbon monoxide is produced, which leads to carboxyhemoglobin levels, and carboxyhemoglobin level gives cherry red discoloration. It also occurs only in either in same thing in the track. It will occur in contact. Otherwise, around other. See, cherry red discoloration basically occurs in the blood. So it will not occur on the margin. It can occur, but rarely. It usually occurs in the track, in the close range of contact, in the contact, basically in contact wounds. Sometimes cherry red discoloration can occur in close range also. Now coming to another important aspect is size. Entry wound is larger or the exit wound? Entry wound is larger or the exit wound? Usually, exit wound is larger than the entry wound. Usually, exit wound is larger than the entry wound, except in case of contact wound over bony prominences, like scalp. Usually, exit wound is larger than the entry wound, except in case of contact wound over bony prominences like scalp. For example, what happens, suppose a bullet is fired in the scalp, in the contact wound is there, the gases which are produced, they will go, there is a very thin tissue between the skin and scalp. So these gases will go between the scalp and skull, they will not get enough space to expand. The gases will not get enough space to expand, and it will lead to bursting of the skull. It can lead to bursting of the skull because so much gases will be there, and they will not have enough space to expand in the skull and the scalp. So it can lead to bursting of the scalp, which can lead to large wounds. So very large cruciate shaped or stellate shaped wounds can be produced. Large cruciate or stellate shaped wounds can be produced in these conditions, which can lead to bursting of skull. This can lead to bursting of the skull in case of contact wound over bony prominences like scalp. So just to summarize, this singeing, blackening and tattooing, they are found basically in close range wounds. They are just listen, singeing, blackening and tattooing around the margins are basically found in close range wounds, and this large cruciate shaped wounds or bursting of the skull, large cruciate shaped wounds or bursting of the skull basically occur in contact wound over bony prominences. So in this question, what's the answer? Contact shot. Contact shot is the answer. person committed suicide by shooting himself in right chamber associated with charring. Charring is burning. Burning will occur everywhere. In contact with also fire, the flame will go inside. It is not saying burning of the hair. It is simply saying charring is there. If the flame will go inside, the underlying trap will also be charring. I told you that in a contact wound, singeing, blackening and tattooing, these effects go in. Please no side talks. These effects go inside the trap of the wound. So effect of flame will also go inside the trap of the wound and charring will occur. What happened? Any doubts on this one? Question number 5. Question number 5, what's the answer? How many of you say A?
The question was according to the patient's passport allowance, what is the
Yes, I know that's the question. Question number 5, what's the answer? Okay, now I will tell you this. First of all, what is 304 AIPC? See, no IPC is especially for doctors. All the IPCs are sections in general. All the IPCs are sections in general. 304 AIPC is for death due to rash or negligent act. Death due to a rash or negligent act. Punishment is up to 2 years. Punishment is up to 2 years. Now, in the past 7 or 8 years, or past 10 years, what happened is, because of this media and all, which exaggerated the medical negligence cases, the people started filing cases against the doctors, even for mild negligence. Even if suppose a patient had died because of disease itself, even the lawyer used to approach the relatives and they say that you file the case against the doctor, you can get a good compensation. Many times the doctor themselves used to get afraid that why to go into this hassle. They themselves used to go for out of the court settlement and they used to pay patients hefty amount, 5 lakh, 10 lakh, 20 lakhs. So what happens is around 3 years back in 2007 or 2008, a case was there in Supreme Court regarding medical negligence of a gynecologist. It was actually not a negligence. The patient died because of normal complication during delivery. The court ruled that this section 304 AIPC cannot be applied for mild negligence. Mild negligence is a very common negligence which can occur, it's a human error. It can be applied only in a case of gross medical negligence. It can be applied only in a case of gross medical negligence. Okay. What is res ipsa loquitur? Res ipsa loquitur means thing or action speaks for itself. Thing or action speaks for itself. What does that mean? Normally, in a court, the person who complains against anyone, he has to prove. Onus of the proof lies on that person who is framing the charges. Suppose a patient thinks the doctor is negligent. Suppose I will be talking about civil case. A patient complains against the doctor. So patient will have to prove that the doctor is negligent. Doctor will not have to prove that he is not negligent. The patient will have to prove that the doctor is negligent. In a criminal case, suppose a person has murdered anyone. He is a criminal. The person who is accused, it is not his responsibility to prove that I am innocent. It is the responsibility of the state or the government or the public prosecutor to prove that the accused is actually an accused person. He has committed a crime. So the burden of proof or the onus to prove lies on the other person. The person who is, it doesn't lie on that who is accused. Burden of proof never lies on the person who is accused. It always lies on the opposite person. For example, if patient is having charges against the doctor, the burden of proof will usually lies with the patient or with the government. It will not lie with the doctor. But in the case of res ipsa loquitur, the negligence is so obvious. Please mark my words, I am not saying that the negligence is gross or mild. I am just saying when the negligence is so obvious that patient will not have to prove anything. It will be obvious that doctor has done something wrong. For example, doctor has done the operation on a wrong limb. Doctor has not given anti-tetanus serum. Doctor has not given wrong prescription and the prescription slip is there. So in these conditions, it will be evident. It will be the thing or action will speak for itself. So this is the phenomenon of res ipsa loquitur. But this will not. Many students confuse that in this question, the answer should be res ipsa loquitur. No, the answer cannot be the res ipsa loquitur because res ipsa loquitur will be applied for mild negligence also and gross negligence also. Only thing is that negligence should be very obvious. The only thing is res ipsa loquitur is for where it does not matter whether the negligence is mild or gross. The doctrine of res ipsa loquitur will be applied to any negligence which is very, very obvious.
Excuse me, sir. Sir, can you
Just a second, she is asking a question. Yeah, please be loud. So the question that she is asking is, suppose a doctor has removed wrong kidney and the patient dies. Will this section will be applicable or not? 304 AIPC. Yes or no? Yes, obviously it's a gross negligence, it will be applicable. It will also be obvious, so the section, it will also be res ipsa loquitur. I agree. It will be both gross negligence as well as res ipsa loquitur. But the question here is 304A IPC is always applied to gross negligence. It may or may not apply to res ipsa loquitur. Suppose the doctor has not given anti-tetanus serum. Okay, or doctor has given wrong prescription. Prescription slip is there and slight wrong amoxicillin dose he has written 2 grams 3 times a day. It's wrong. But this section 304A IPC cannot be applied for that. Suppose doctor has given, the doctor will be, as I mentioned, doctor will have to, the case will be taken in a court and he will have to give some fine, some money he will have to give to the patient. But it will not be a 304 IPC is a criminal. All the IPCs are criminal things for criminal offences. For civil offences, there is no IPC. These IPCs are all are for criminal offences, 304A and all. Okay, for criminal offences. Res ipsa loquitur is for both civil as well as gross negligence. Criminal, it cannot be applied for both civil negligence as well as criminal negligence. But so in a case of 304, it's not necessary that in each and every case of res ipsa loquitur 304 AIPC will be applied. In some of the cases of res ipsa loquitur, it may be applied, it may not be applied. It will depend upon whether the negligence is gross or not. It's a subjective thing, it can be defined only by the court. It can be judged only by the court and after taking the opinion of the expert doctors. It's a very subjective thing which there cannot be an exhaustive list. It will depend upon case to case basis. In this condition, 304 AIPC will be applied or res ipsa loquitur. The answer will be res ipsa loquitur because applying of section many times it depends upon very minute things also. But it is a case of res ipsa loquitur, there is no doubt. Then the answer will be res ipsa loquitur. You were asking something?
Yes, sir. Civil negligence comes under what section?
Civil negligence?
If it is not accountable, if it is not coming under 304A, for example, if a doctor has left scissors or say cotton ball inside, what section does that come under?
Section, there is no IPC section for that. There is no specific IPC section for civil negligence. There is no specific IPC section for civil negligence. The person can go into Consumer Protection Act. Okay, it's not necessary for each and everything a section has to be applied. So, IPC section has to be applied for a criminal case, not necessary for a civil case.
So this will be handled by Consumer Protection Act.
Yes, it can go in a Consumer Protection Act. Consumer Protection Act and civil code has the same power as that of civil codes. Okay, the leaving a pair of scissors inside the abdominal cavity is a criminal negligence. But what I am saying is, it also depends, many times it is subjective. If the patient thinks, patient can go to a civil court also. See, in our law, the things are subjective. Things are not objective. It cannot be possible. It varies upon case to case basis. We cannot say the leaving a pair of scissors inside is it should be civil negligence or criminal negligence. The chances are it has to be criminal negligence, but it is always on a case-to-case basis. If someone asks you what it will be, it will always be a criminal negligence. Leaving a pair of scissors inside the approval. He is asking in a case of civil negligence, what is the section applied? He is asking in a case of civil negligence, what is the section applied? Example of civil negligence is suppose the doctor has given wrong prescription. Instead of prescribing amoxicillin, dose is overdose. Please no side talks. Suppose a doctor has prescribed overdose of amoxicillin because of which the patient had to suffer diarrhea, severe gastritis and all. It can be a case of civil negligence. Okay, it can be a case of civil negligence. So please no side talks. Please no side talks. Okay. Question number 6. What's the answer? The answer is Dyke. See, if we talk about lesbianism, oblique tribadism, there is a active masculine female. The masculine female, which is supposed to be an active partner, is called Dyke. The masculine female who is the active partner is called Dyke, and the feminine partner is called Fem. The feminine female, that is the passive partner, is called Fem. Okay. Coming to sodomy, also called buggery. It's of two types based upon the passive agent. Based upon the passive agent, it can be of two types: gerontophilia and pederasty. It can be of two types: gerontophilia and pederasty. The active agent is adult in both the cases. The active agent is adult in both the cases. The difference is in passive agent. Difference is in passive agent. The passive agent is adult in gerontophilia and it is child in pederasty. The passive agent is adult in gerontophilia and it is child in pederasty. The active agent adult in pederasty, the active agent adult in pederasty is called pedophile. The active agent adult in pederasty is called pedophile. And the passive agent child in pederasty, the passive agent child in pederasty is called catamite. The passive agent child is called catamite. No. Ultimately, both the markings occur on bullet. Primary marking occurs because of the manufacturing design on the bullet. The bullet are designed in such a manner that these markings occur on them. And in the secondary marking, there is some. See, suppose, okay, I will just listen instead of writing. Suppose 100 firearms are made by a company of the same type. So firearms are of various types: rifles, revolvers, pistols. Among rifles also there are many subtypes. Suppose same subtype of a firearm is produced by a company. 100 firearms are produced. Even those 100 firearms will have some characteristic features which will be similar in all of them, but there will be some features which will be different in each and every weapon. It is inherent. Two things can, even no matter with how precision they are made, there will be some difference will be there. No matter with how much precision two firearms are made, there will be some difference will be there. It's a normal manufacturing process defect, you can say. Okay, so this defect in the firearm, you can say, I'm just calling it defect for the purpose of understanding. In each and every firearm, there will be some defect or some characteristic feature will be there. So that feature, when the bullet is fired, the feature of that firearm gets marked on the bullet. I will explain you like this. For example, in a diagram, suppose this is the